Good afternoon. This is Nancy Anderson from SMI, and I'd like to welcome you to this continuation of a series of huddle calls for SMI members during these very challenging times. As always, I'd like to start by saying thank you to all of you, both suppliers and providers, who are on the front lines working so hard to help healthcare deal with this crisis. We are so very grateful for your hard work and dedication, and we thank you for sharing your very valuable time with us today. As in our previous calls, we completely understand that some of you may need to leave during this call, and we also know that others might join as the call proceeds. We just want to be flexible. It's designed to be a time for open discussion, so you are welcome to be with us as long as you can stay. These calls are an opportunity for all of us in SMI, our members, to share insights, ideas about the current crisis, and to work together to look for solutions that we can all use to address the issues we're facing. We are recording these calls, so all members will have access to them, and we will be taking and sharing notes from each call as well. On last week's huddle call, we talked about tools available and heard from Jim Francis and Amanda Chawla about their strategies in managing through this crisis. Next week, we will feature panelists Jane Pleasance from Duke, Steve Gunderson from BD, and Jeremy Strong from Rush Medical Center, all sharing their experiences. We'll be sending out that invite on Monday. And please be patient with us as we try out different technologies for these calls over coming weeks. We are just learning how to work in the virtual world, and we appreciate your patience as we do that. We currently have all of you on mute during our opening remarks, and then once our speakers finish their comments, we will be open for discussion from the entire audience. To participate verbally, you can raise your hand by clicking on the icon, and Christine, if you have the slide to show them where the icons are, and we'll call on you and unmute your individual line. You can also type questions into the chat box. We have a wonderful and pretty big group on the call today, so if we don't get to your question during the call, we will send out the chat and responses after the call. Without any further delay, I would like to introduce Joe Walsh, who will be moderating our session today. Joe is a coach, educator, and advisor with Supply Chain Sherpas, and he has a deep healthcare supply chain and leadership expertise. SMI this week published a blog from Joe where he shared his thoughts on leading through crisis. He's a valuable advisor to SMI, and we've really appreciated his guidance through this guidance to our organization on an ongoing basis. We're also honored to have with us today two leaders who are in epicenters of the current crisis. Donna Drummond, who's the Senior Vice President at Northwell Health in New York, and Regine Villain, who's the Senior Vice President in Supply Chain at Ochsner Health System in New Orleans. Thank you all for joining us today. Joe, I'll turn it over to you.
Thank you, Nancy. I really appreciate the time and the introduction. And I want to start by just acknowledging how much our world has changed in just a few short weeks for everyone that's actually with us today. And I sincerely hope that each of you and your families and that your teams are healthy and safe as we actually go into this session today and obviously going forward. I also want to thank you for investing the time today so that hopefully you can accelerate tomorrow with some of the insights that we get into today. So, Christine, if you can go to the next slide. We're going to talk about, leading through crisis through some stories, and I'm only going to share a few minutes here at the beginning. I thought sometimes pictures are actually more helpful. In the world that we live in today, even in our personal lives, I think we can appreciate the contrast of what's going on, that there's lines because of social distancing kind of wrapping around Costco, for good reason, by the way. The toilet paper crisis is kind of hilarious, but nonetheless, it's real and it's happening. And not just that, but it's just human nature for us to kind of do this panic buying, which is kind of a proxy for what we're experiencing in our healthcare supply chain. And then there's this eerie silence in contrast to what we're experiencing in the grocery stores that's taking place in places like Times Square, which just doesn't really, it's like cognitive dissonance. You can understand why it happens in our personal lives. And then on the next slide, just a different set of pictures. It's kind of interesting where you have patients who are suffering in truly unimaginable ways. And I'm glad that we're starting to hear some of those stories, and I'm still incredibly heartbroken to know that those stories exist. Our clinicians and our supply chain is actually suffering in unspoken ways. We've not yet heard the stories of how our clinicians are suffering. We might see pictures of them being tired and exhausted, but we're not really hearing about the emotional toll it's taking on these caregivers and the folks actually in our physical supply chains moving the products and being exposed, and even the illness that may come from that. Those stories are yet to be told. Our supply chain itself is in chaos, and that might be putting it lightly, where we've got federal and state interventions, whether they're welcomed or not, they're here. There's even third parties that are intervening. Again, whether they're welcomed or not, they're here. And of course, we've got new changing care locations. People jogging around Central Park, just to put this in perspective, people jogging around Central Park where you've got these field tents in the middle tending to very sick patients. It's kind of surreal if you, again, we all experience this every day, but our work lives and our personal lives have been thrown up in the air and we don't know where it's yet coming down. If we go to the next slide, what's really interesting is we've talked about what's happening outside of each of us as leaders. And since Friday, the 13th, March 13th, I actually stopped traveling, got back into the office here in Colorado, and I've not traveled since. So it's been 20 days, work days, where I've had 82 conversations with providers, suppliers, distributors, GPOs, folks in the industry talking about what's going on. And at the end of every conversation, I will usually ask somebody, what is the one word that describes how you're feeling about the world today? And again, this is not an experiment in psychology. These are the words that they've given me on the right, not in order, just random order. Compassion definitely comes up, like we're almost over functioning on compassion, understandably. But the words that are underneath it are probably equally important here that I don't want us to actually miss, and I'm not going to go through them. But this is what we are experiencing. And if these feelings, of course, are understandable, but if we actually put some of those feelings, like fear and anxiety, into the driver's seat, then we might impair our actual ability to lead during this time of crisis. So that is what inspired the blog. And if you go to the next slide, Christine, that's what kind of inspired this blog. And there's tons of resources out there. We're not going through this. Through the stories that Donna and Regine share with us, and the fact that they're with us today, we're going to hear how you inform others and how you guide the work and how you unite and even how we connect with others. But I think my hope for all of us, especially for all of us on the phone today, is that we first practice self-care. Because if we're not taking care of ourselves as leaders, then we can't actually be available to others. And that's the only one I kind of want to pause on for now. The blog has a little bit more detail, and I will all four of these. And I think the stories themselves is going to be much more impactful than going through each of these right now. So we can come back to it if we need to, but let's move on for now and go into this concept of not being able, and Christine, to go to the next slide if you don't mind, that we can't pour from an empty cup. And I think we all intuitively know that, but it's very difficult to slow down in the midst of a crisis when we're so in service to others, in service to our teams, in service to our stakeholders, in service to our patients ultimately. And it doesn't matter what part of the supply chain we sit at. This is not just for providers. This is for suppliers. It's for GPOs. It's for everyone, right, who's actually going through this. We're all seeing the patient suffer at the end of the day, and we're all trying to actually kind of run towards that fire with the biggest hose we have to put that fire out. But if we don't actually fill ourselves up first, we can't pour from that empty cup. And one of the first things that we actually have to recognize is we're all going through some level of grieving the loss of normalcy, and we don't even know what the new normal is going to look like yet, and we're all in transition. This was the moment I had with Nancy and Tom a couple weeks ago when I had to acknowledge, actually it was last week, it felt like it was a month ago, when I had to acknowledge that I was grieving this process, that the normal that we all knew the world to be is behind us. And there's many other things that until we're actually kind of willing to practice self-care, set realistic expectations of ourselves and others, and then again, stay connected to others and practice physical distancing. I don't even like the phrase social distancing because it implies disconnection with each other. And unless we're actually standing on stable ground, we can't really, lead our teams that need us more than ever right now. And so it's with that, I'll introduce our first person who's going to share with us some stories. And by the way, neither of our folks today need introductions. Everyone knows Donna, of course. Donna wears many hats, and I think the introduction that's really relevant here is that Donna's been elevated to a role that includes supply chain and many other responsibilities. As a chief expense officer, Donna's also the managing director of True North Enterprises, and she's been with Northwell for 16 years. And Northwell is uniquely positioned for this conversation with 23 hospitals, 800 outpatient facilities in Long Island, Manhattan, Queens, and Westchester. So, I mean, this is right in the hot spot of what's actually happening. And I want to give Donna some time here, and then we'll come back to Regine And what I really want to honor is that back to that inform and unite, just those two dimensions of how to lead in crisis, the fact that Donna and Regine have found time, have made time to take a timeout in their day when understandably and justifiably they might say, no, I'm not going to do it. But they've shown up here today to share their stories with the intention of helping the entire industry be better, to actually kind of focus on we and not me, is already a demonstration of what leadership looks like in the face of crisis. So it's with that, Donna, I might ask you this question to get us kicked off, right? You're in one of COVID's hotspots, which is approaching, hopefully, the peak of the curve before some other parts of the country. So based on this experience that you've had thus far in one of these hotspots, what leadership advice might you share with providers and suppliers that we have with us today?
Well, it's as you're going through this, and hello everybody, good afternoon. As you're going through this, you don't think so much about what am I doing as a leader. You're just trying to gather people together to get done, what needs to be done. And it all kind of sorts itself out, and you're constantly trying to praise for how people are going above and beyond, provide direction as to what needs to be done next, encourage flexibility. That's not everybody's strong point, and say, yeah, I know we were focused on that yesterday, but we got to be focused on this today because this happened and this is what's different and this is what's going on. So it's just a kind of an enthusiastic cheerleader. I personally don't source things very well. It's not what I do. But I listen to the questions coming from our senior leadership. I move things to the people that know them best and try to get out of their way so that they can do what they need to do. One thing that we've learned is time. You've got to give people time to be able to do it. The need is so strong. The need's immediate. You never forget for 1 minute that there's a patient at the other end of this, and to just recognize that you got to sit back, you got to take a deep breath, and everybody's working as hard as they possibly can, and just appreciate them for that.
Yeah, it's wonderful, Donna. Is there anything else you want to share about kind of what your experience has been, thus far, just generally? Certainly, there's no constraint to the conversation. I want to make sure that you're able to kind of share your insights as to what you've experienced thus far.
Sure. I can tell you that it's been a month straight. The entire team has worked a month straight. We've not taken a single day off, and most of those days have been between 12 and 16-hour days. The way we're structured as an organization is we have a strong emergency management centralized team. I am the supply chain and logistics head. So I sit on calls twice a day with the senior leadership of the health system. As you've probably all seen on TV, since we are the epicenter, Northwell has been in the news quite a bit. So in addition to getting what we need, where we need it, the deliveries, the orders, everything that we've needed to do, we've also had to, support those who are getting interviewed by CNN or 60 Minutes or, the Wall Street Journal. We've had to provide them with information. The state demands information every day on where we stand with every single one of our PPE items and our equipment, particularly our ventilators. We're processing that information. So there's a lot of, and it's wonderful. You provide the information and they're helping us as much as they can with vents and supplies. It's been a very interesting journey. We're very thankful for a wonderful and dedicated team. Supply chain people are great. They get in the business because they want to help in situations like this. They want to make things happen. They want to get things done. So it's a great group of people to work with. But it's been, if I have to choose a word, it's surreal. It's strange to be speaking to you and speaking to my team from my house. We were all together in one room, and then a couple of people unfortunately were positive, and we were all put on quarantine for 14 days. And we started working from home, and we make it work. So it's just been an interesting experience. There have been some surprises. There's things that we have a lot of hurricanes in New York, so we're always ready for those. But there's things associated with this pandemic. And I'll just give you one example and then I'll stop talking. But just something I want everybody on the phone to know, anybody that runs hospitals, oxygen. Our plants are old. And when 75% of the people in the hospital are on oxygen, it taxes your plant. That's something we've never had to deal with or contemplate before. So that's something, as you're preparing, as it spreads around the country, please do whatever you can to make sure you have backup oxygen sources and to make sure that your plant is in the best shape it can be.
Donna, I'm really blown away by your ability that while you're in the storm, you're able to actually pull up from it and actually acknowledge some of the lessons learned already and extend those. It's not an easy thing to do, and I just want to acknowledge you for being able to do that. It's, again, one of those leadership attributes that I don't think we often recognize enough, to be able to kind of like really recognize and share some of those practices with others before they get there. And so we're definitely going to give everyone on the phone time to ask questions. I'm going to introduce Regine next, and maybe ask Regine a question as well. Regine's, interestingly situated because she just celebrated her 1-year anniversary. She's been with Ochsner now and celebrated 1 year in February, and she's the SVP of Supply Chain and the Chief Supply Chain Officer of Ochsner. And I can't imagine what it felt like to be celebrating that as we kind of leaned into this COVID-19 pandemic. And she's also been the VP of Supply Chain Operations at NYU. So, I mean, she's, obviously experienced what New York's going through as well. And then I just want everyone to recognize that Louisiana is also one of the top 3 hotspots in our country right now. So it was with intention that we wanted to really have 2 leaders on the phone who are, I think, experiencing, to use your phrase, Donna, a surreal experience right now, and surreal moments in time, and to kind of get their reactions. And so, maybe Regine, same type of opening question, right? I mean, with maybe just the addition to say, given that you're in one of these hotspots, maybe what leadership skills are you pulling from in the midst of this COVID-19 response? And of course, anything else you want to share as your opening comment.
Thank you, Joe, for the introduction. And yes, I have to say, before I say anything, I completely agree with everything that Donna said here. And on my end, it's really been about being calm in the storm, because I realized very quickly that as a leader, everybody's looking up to you, and they're basically emulating what you are doing and what you're reflecting and what your emotions are. And so very quickly, I learned that it was very important for me to remain calm and to make sure that I was communicating and over-communicating. So we pretty much set up our incident command center almost like right away. As soon as we knew that this was coming, we hadn't even had our first case, we set up the incident command center. It's been about making sure that, almost exactly like what Donna said, letting the folks who are the experts within your team lead. So one of the principles that I've always loved and I've always loved to emulate is also making sure that there's a deference to expertise. My title does not give me the expertise, but those people who are on the front line doing the things that they need to do, I trusted them, I communicated so to them, and I just got out of their way and made sure that they knew I was there for them, that I am there for them, and I'm this person who's also leading with them. It's important to lead from the front, to lean in. And, what I like to say, you stand in the arena with your team. It got very quickly, very ugly, like in a matter of hours. Between the time that I said that we said, okay, well, we can see this thing coming, we can smell it a mile away, let's get this going, and let's get the incident command center, let's start to pull ourselves together. Between that time and when it started to really, hit us, it was less than 24 hours when we started to really see things ramp up. And they ramped up really, really quickly, really quickly. So, again, being calm and enabling your listening skills. It's just sometimes it's easy to just want to jump in. You just have to make sure that you don't go there, because your team is also equally scared and stressed and trying to figure out exactly what to do. It's just very important to remain grounded and make sure that they know that you have their support and that they are just there and you're just there to lead and to keep going. I mean, there are a few things that I can talk through, but let me just stop here.
Yeah, and Regine, I really appreciate, the framework you've outlined, right, around being calm in the communications, and the framework that Donna's outlined as well around the clarity of focus and giving people time and being a cheerleader. And you also mentioned sitting back, Donna. And so let's open it up to folks and see where they want to take the conversation and where they want to get curious. And so if you want to ask a question, you can either type it into the message board on the right, and Christine will let us know what that question is. Alternatively, you can raise your hand if you're courageous enough, and I encourage you to do that, right? It's a demonstration of leadership on top of it. So raise your hand virtually, of course. I realize we can't see you, but you can do it on the app on the right-hand side of your screen, and then we will be able to call on you and you can kind of ask your question. So let me pause first, and I have to ask, I can't see them, so I apologize for that. But Christine, is there anyone that actually has already submitted a question that we need to go to?
This is Nancy. I've got a question from Dee Donatelli in the question feature. She's wondering if there's any comments on the morale of staff and how you're thinking about the staff morale as you're going through this crisis.
That's a great question. I can start. One of the things that I really appreciate that you said, Joe, is the whole self-care thing. As an organization, Ochsner is over communicating about self-care and also emulating those kinds of principles. It is really important for us to stop and make sure that we're taking care of ourselves and our teams. So what we've done, in the supply chain is, first of all, we're present, we're there, we're communicating. No message is too big, too small, too difficult to pass on to the team. They are there with us, and we've made sure that they are fully engaged in everything that we're doing. We actually, from that first week, we went through, just from a supply chain point of view, we went to 3 checkpoints a day with the leadership of the supply chain team, and then 1 with the entire team. So that's 4 different supply chain communication, just making sure that we were listening to them, we were soliciting their input, and we were sharing with them also what we were going through. We allowed ourselves to be vulnerable, and with that, they felt more comfortable to also share some of their stories, and together we went through to get answers. If it was something that had to do with HR, it was something that had to do with whatever it is. The other thing that the organization did, which I thought was absolutely phenomenal, was also from the beginning, the very beginning, Ochsner immediately went through and offered child care for every single employee who needed it. So that was also something that eased their stress, and so people felt really good and felt supported. We intentionally really make sure that we do that. For the supply chain team, I've instituted something that I'm calling a tap in, tap out, basically. And we use this phraseology internally when we're saying, okay, somebody's getting crispy. With the stress, they're getting all afraid and stuff, and we recognize that, and we recognize the signals. So we have a tap in, tap out. We recognize that we need to build redundancies. We can't just lean on one person always, So we've intentionally done everything we can to make sure that we're spreading the wealth and that everybody's jumping into the arena so that we're all supporting each other. The feedback that we've heard from the team has been absolutely positive. They love it. They feel supported. They feel that we're there with them. And so with that, the morale, I would say, is actually really good. And people feel that this is something that as a team, we've really done well and we've overcome, and that we're going to be okay.
It's really impressive, Regine. You've got system level strategies like the child care. You're obviously being incentivized by modeling as leaders what it means to practice self-care, and then you've put these things in place like the tap in, tap out that are really helpful with the team itself. Just before we move on to the next question, I just want to make sure, Donna, are there also uniquenesses to what you've discovered in this, I think, pretty significant and extraordinary time to actually kind of elevate or at least keep the morale of the staff in a moment like this?
I'm sorry, Joe, before you go to Donna, and I apologize, Donna, another thing that the institution did, which was absolutely impressive, is this was the time where everybody was expecting to get their bonuses because of the way that we do our cycles of evaluations and bonuses. So bonuses were due, I think, in April. So the board actually voted to accelerate and give everybody their bonus well ahead of time and pushed out a bonus to everybody. In addition to it, the people leading the front line, we identified categories of caregivers and people such as the supply chain techs. Everybody has gotten an extra, pay incentive to also support them. So people really feel good about it.
Wonderful. Donna?
Sure. The only thing I would add, our bonuses are on their normal cycle as far as the leadership team. So they made an announcement early on that even with the expenses of the health system being extraordinary, that they would still be paid. So they weren't paid early, but everybody got a comfort that they would be coming. But those are the senior leadership ones. As far as the organization is determining what type of additional pay is going to be made to employees, and there's a buzz about it, so people are looking forward to that. But I think the childcare, just like they did at Ochsner, happened as soon as possible. We've also got hotels. Now, I think we've got 40 different hotels now available. If employees are working on the front line and they feel uncomfortable going home and don't want to expose their family to COVID, we've engaged those. From a supply chain experience, except for the staff that is working directly in our warehouse, our contracting and procurement staff are all home with their families for the most part. There's a few key staff working in the offices, but other than that, so they have not had to avail themselves from that offer. But I think by and large, the morale is strong. Everybody's tired, but everybody knows that they're supporting the frontline staff, and there's a definite energy from that. Definitely, I was on a call the other day between the warehouse staff and the staff at the sites, and there was, you got to return the U-boats, you got to return the totes, and there was definitely a little, you tell, exhaustion, right? Everybody's trying to do the right things. They're not returning them because they're using them for extra stock. So you kind of gotta make a couple jokes about how of other things that are going on. And but all in all, there's a definite camaraderie I think the morale is almost better than it even normally is, because people feel like they're part of a greater goal.
It's amazing how people can rally around a purpose once they're aligned to it. So it sounds like, Donna, both you and Regine have done a great job of helping people understand that greater purpose, which is, often we take for granted in healthcare, but in crisis can really fall apart when people are stressed, and then the stress overrides the purpose. So, kudos to you for acknowledging that and leaning into that. Nancy, are there other questions or folks with their hands up?
Yes, Joe, Nora Frank from UPMC has a question. Nora, go ahead.
Hi, everyone. So first, I want to say thank you to the SMI team for continuing to pull us together through this time, and to the panelists today for taking time out of what I know is a crazy schedule. The question I had, though, is really, with all of the remote working and linking into that, have you had any tips or successes you could share with how you've kept your team connected and feeling like they're together despite the distance between you? When we're busy, we tend to just lean into our emails and our work, and we forget to make those connections. So if you had any successes in that or things you could share, I'd love to hear them.
So this is Donna. We've heavy use of Microsoft Teams. We found that it's a great tool to use. It kind of helps people not talk over each other. We're New Yorkers, so that happens a lot when you're just using a conference call. And you can see people's faces sometimes if they want you to see it or not, but it's really helped the team, come together. And what we're finding is we'll just grab people together for 15 minutes to discuss a particular issue, get the experts on the call, and then kind of it's like a quick huddle. Everybody goes and does what they have to do. So I'd say that's the number one tool.
And for us, like I mentioned, we are almost continuously connected. Besides those daily calls that I mentioned, I also pull a once a week call where it's more about almost like a virtual town hall with the intention of making sure that we're asking those who are working remotely how they're doing, what's working for them, what's not working for them. And we want to make sure that we remove the barriers. You know, some people have had issues with their connectivities at home. So, you know, I've engaged the IS team to go and help them be able to have, you know, better connectivities, whether it is, you know, making connections with them and allowing them to be able to have better service that they've had before, upgraded their bandwidth and what have you. So those kinds of things have been really helpful. And just right before the crisis, we had made a decision as an organization anyway to move to away from WebEx to Zoom, even though there's been some very interesting press about Zoom lately. Zoom has been, you know, a good tool for us so far, for us to be able to come together. And then cell phones. I don't know about you guys, but cell phones have always been, for me, that's always been an unbelly button for me. But more than ever, cell phones have become a means of communication, you know, a quick means of communication, because your inbox get really flooded very quickly all day, and you just don't have time to be going through all emails. And so everybody knows that when there's an issue, they can just like reach out to you. So if they're having connection issue at home or what have you, we just work with them. So at the beginning, some people were not very comfortable with the idea of working remotely. Believe it or not, some people prefer to be in the office. But once we remove the barriers that they identified, everybody is really leaning in right now and digging in, and they're just really enjoying it. And with Zoom, they've been able to create different workrooms where they're working together and all that. So that's worked really well.
That's really great. Nora, Dee, thank you very much for your questions thus far. And who else do we have either on the line or with their hand up that wants to ask a question?
Joe, there was a question that was submitted. Can each of you describe observations for best practices regarding supplier engagement during this crisis? What are the common threads that distinguish the best suppliers from the rest of the pack?
We have been very lucky. Our suppliers have come to the table. Phyllis Phyllis McCready, our Chief Procurement Officer, has wonderful relationships with our suppliers, and I think there's a mutual respect. And frankly, everybody knows the situation we're in. So to the extent that they could provide, they have been. We really have been impressed, and there's some that simply can't. They're out of stock. It's unprecedented what we're going through. So and we recognize that. So there's no animosity. It's that feeling that we're kind of all in this together, and they're all picking up the phone and they're doing the best that they can. What we have experienced, on the other hand, that has not been favorable is all of these many hundreds of thousands of people coming out of the woodwork trying to sell us things that we have no relationship with, that say that they know how to get to the 3M masks and that they're in the airport in Texas, Mexico, Canada, or JFK. The stories go on and on and on, and it's been awful going through that, having to follow up on every lead because of the situation we were in. I think that at the end of this, we'll come out of it really valuing our relationships with our trusted suppliers, really seeing the value that they bring as opposed to these other things that we've been bombarded with.
Again, same thing here. Our traditional suppliers have really stepped up. Many folks actually just proactively reached out before we were even thinking about them, and just offered to support us in whatever way that they could. And certainly the folks with whom we have worked, very closely in the past, our distributor, our GPO, some of those, top 10, top 15 key suppliers with whom we're working. Everybody has stepped in with us. I'm going to continue to keep that theme of the arena. Everybody stepped in ways that we could not even imagine. But I also have to say that it doesn't necessarily happen on its own all the time. Sometimes it really takes, like a different kind of conversation to open your senses to things that you would not normally think about. So it's like, wait a minute. You know what about this? What about that? We have not necessarily thought about this before. Can you guys go and help us with that? And the other thing is traditional suppliers became very quickly untraditional suppliers, and also the other way around. Those non-traditional suppliers with whom we were doing business before that we didn't necessarily use for med-surg and stuff like that just also became great sources through their own network and their contacts, so it's really important for you to think about everybody that you can think of. So you certainly, if you look at it as a tiered approach, you start with those folks with whom you are already working very closely. Your distributor, your GPO, your top 10, everybody has a top 5, 10, strategic partners. You start with these guys and you put them to work. You can't be afraid to challenge them though. And you gotta challenge yourself as well to think outside the box. So, hey guys, we really need for you to step in and really figure out how we can do this, so getting 80% of is okay. This is not the time for perfection. It's the time for us to just get stuff done. And so let's go for the 80% and let's try to figure out how we can mitigate the 20. And then you have your non-traditional kind of med-surg suppliers with whom you're already working, like your EVS partners and what have you, that you would not necessarily think about. But these people have access to things and network that we don't necessarily use on a regular basis. But by pushing that dialogue, you find yourself opening a whole different kind of world also through them. And then, of course, those dreaded and awful people that have been flooding out emails, you don't know where they're coming from. They all have the same story. I want to say that 95% of those people, I've just completely flushed them. At first, it was like intriguing. Then you realize that it's the same play. And frankly, nobody really has a line of sight. So if you're now going to go into that third tier of completely non-traditional folks, I would say first, you still need to try to do it with a measure of being able to verify and validate, because everybody's claiming they can get you XYZ. Everybody wants money up front. Everybody's telling you, yes, we can get it done. But you know what? That's not necessarily the case. So you have to be very judicious about that. There are a couple of them out there that actually can come through. But I tell you, you have to keep your wits together in order to make sure you're not falling into something you can get out of.
So Regine and Donna, I almost want to ask a follow-on question to, we have a lot of suppliers that are with us today on the phone. And for them, what they may want to hear about, and I'm kind of anticipating this, right, is a lot of them might feel a little bit stuck, like they really want to be able to help, but they don't know what help looks like. And obviously you're all busy with good reason, and it's very difficult for them to know how to engage you. And one of the things might be if you could give them an example, and only if you have one and you're willing to share, of, let's say, a traditional supplier that's done something really innovative or gritty that might be outside the traditional, let's say, solution set that they have in response to coronavirus. So, I mean, have you seen a traditional supplier that you often work with in healthcare do something pretty non-traditional that's actually helped you? Is there an example you'd like to share?
Sure. I could give you probably 5 of them. We have seen suppliers that we did not choose their product in the past, but it was equivalent to something that we've needed, come up with humility and give us the product for free and say, here, you know what? We always want you to try this. We know when we didn't win the bid, you didn't give it to us because your staff, didn't like it as much, but here, we think you need it now. Try it, and we're not charging you for it, and we're going to give you a lot of it. I mean, that says something,
wow.
Right? That's amazing to me. We found another example is we found, ventilators are a challenge, right? So we have so many ventilators. We bought as many as we could. Our team developed, as in the Wall Street Journal, a way to use BiPAPs and convert them into into ventilators. It had to be a particular BiPAP. We needed some 3D printing. We needed some more HEPA filters than we had before. They came to the table, said, hey, this is great. This is, you guys have invented something. We love it because it adds to what our product can do. Let's see how we can help you with this. Let's see how quickly we can turn something around. I've personally worked with one of our suppliers that we have a very close relationship with regard to sterilizing N95 masks, and how quickly can we get something written through the FDA? I can't even tell you. I've never seen things move as quickly as they have been these last couple of weeks. Anybody that we have called, we're using some drugs that nobody else are using for some clinical trials. Because of these relationships we have for years, you get to the right person on the phone and they just, what can I do and how quickly can I do it for you? I can't stress enough, our supplier partners have truly been partners through this. And they are truly passionate about it. It affects their families as well. And I can use Regine's words, we're in this arena together, we're all there.
Those are such wonderful examples, Donna, and I love how specific they are in that you have found folks willing and able to actually step into different solutions that might be just outside their normal wheelhouse. That's incredible. And Regine, I want to make sure we get back to questions, but at the same time, if you have examples you want to add to it, by all means, I think our folks on the phone would probably appreciate it.
Well, it's so funny because those are the kinds of things that we've had as well. But I can tell you that the idea of people coming together, first of all, to offer you things that you weren't even thinking about, that's one thing. And I also had a vendor who came to me and proactively said, I know that you haven't used us. It's somebody we were also potentially courting, and we just haven't had a chance to really do any business with them. Just proactively say, hey, listen, I can tell you, because we were, I think, a week and a half lagging behind New York. And they're saying, well, based on what we're saying in Washington and in New York, here is what we have seen. Here is what people have done. And we're happy to help you get your hands on some of those things because we realize that this is something that's going to be very important to you. So those people proactively said, and they were the ones, and I have to credit them, that basically said, you want to keep your eyes out on respirators. You want to keep your eyes out on ICU beds that are probably you're going to start to see an issue with that. You're going to keep your eyes on CRRT machines because we're seeing an uptick in that, in our network. And so anything we can do to help you and connect you with some of those people, we're happy to do that. And regardless of anything, then, it had nothing to do with the fact that, they're not really a primary vendor or even a vendor at all, but just the desire to help and to assist. It's just phenomenal. I just have to tell you, it's been awe-inspiring in that sense that everyone, that's when you realize that this whole thing about us, being different, we're competitors, we're this and we're that. But at the end of the day, when it truly matters in instances like this, you know what? We lose all that pretense because we are all people who are trying to do well for other people, our caregivers, our patients, our employees. And at the end of the day, that's all that matters. And so we have come together, the greater supply chain community, providers and suppliers, in a way that just is unprecedented. And I'm sure at some point you're probably going to go there before the end of this call. But my call to all of us as we're going through this is what we are finding out and the things that we're learning through this. I truly hope that we don't go back to the way things were. There's no reason for us to be divided and to be, contrarians and to be against each other or what have you. There's an opportunity for us to work together in a way that still preserves, our leading edge, but still able to work together as a community for the greater good of everything that's going on around us. That, to me, has demonstrated more than anything that we are able to do it and we should do it.
Regine and Donna, I just want to honor what you're saying. Going back to this topic of leading through crisis, right? One of the dimensions is to connect, with ourselves for practicing self-care, with our teams, which we've talked about, with our stakeholders, which I know you're doing every day, and your clinicians. But the last dimension of that is connecting with our partners, like our supplier partners, for solutions. And that's one that, as we all know, I think traditionally in healthcare, there hasn't been that deep level of collaboration. And, maybe this is one of the bright spots that we'll have to lean on coming out of this, because there's got to be a bright spot, is that maybe it's brought us closer together in ways we didn't expect, between suppliers and providers. And there's a lot more narrative and a lot more story to be told around that topic. So thank you for taking the time today to share some of those stories that I hope bring some inspiration and optimism to the supplier community on the phone, and maybe even some inspiration to the providers on the phone about what's possible if they're not already doing it. So Nancy, Christine, other questions that we want to move to for these last 15 minutes or so?
So
Joe,
this is
Kevin.
Nancy. I wanted to share, Christine, really quickly. This is Nancy. That Regine, relative to your comments about the learnings that we have coming out of this crisis, SMI has already determined, as I think all of you would agree, that that's going to be one of the key focus areas for our members going forward as we look at the agenda for the fall forum. And even as we begin to create this virtual forum for our spring session to replace the forum where we were going to be in person, we're going to be really looking to work with members and focus on the lessons learned. What did we find out through this process that we can use to move forward into a new era for our relationships, for our supply chain? So thank you, Regine, for sharing that, and rest assured SMI is 100% with you. Thank you, Joe. Sorry.
Absolutely. Christine?
Yeah, sorry. Joe, Kevin McMillan from Steris has a question. Go ahead, Kevin.
I'm very sorry, Christine. I do not have a question.
That's like being put on the spot, Kevin.
I'm sorry. I saw your hand up, Kevin. I apologize. Joe, we did get a question going back to staffing. And the question is, what type of call-in reduction are you seeing? This person has heard as much as 35 to 40%, and some out for 2 weeks or longer. And how are you backfilling those positions?
Yeah, and that's probably a two-part question, right, Donna and Regine? There's probably the operational or clinical side of the business, and there's probably a supply chain kind of component as that, and there may be different answers. So by all means, take the question as you can.
So from a clinical perspective, there has been a certain amount of call-in. It has absolutely not been 30%, and it is that's not how our team behaves. There have been, what we have done to supplement our staff is we've redeployed anyone that is not clinical, no longer front-facing clinical. So if they were a nurse working in a call center, for instance, something like that, they were redeployed to the frontline staff. I can't say that everyone wanted to do that, but the overwhelming majority have done it. And then you have, all of our surgery has been canceled, right? All elective surgery. So you've got a bunch of orthopedic surgeons and neurosurgeons and dermatologists and everybody else being at the front line. So we really, I'd say that the story on the staffing side clinically has been, again, that same kind of everybody pitching in. There has been a certain number of call outs, and we've got policies to deal with that. As I mentioned before, I think having the hotels and places for people to stay so that they didn't have to be concerned about bringing it home to their staff was a value added thing. We also are giving out scrubs to anybody that wants them, basically. We've not completed the rollout, but we're in the middle of that so that they don't have to bring their laundry home and do it in their scrubs. So we've been trying to make it as easy as possible with the, making sure they have the appropriate PPE, things like that. So maybe that's been, our experience as opposed to others. As opposed to the supply chain staff, luckily, thank goodness, we really have not had that experienced any call outs.
Regine, anything you'd like to add?
For the supply chain team, I have to piggyback on, I was on mute, sorry. I have to piggyback on what Donna said for the supply chain. We have not had any call outs during this time on the supply chain. Now, I can't necessarily speak for the organization, but in our system calls that we have twice a day, we have heard of very little disruption when it comes to the staffing, as it stands. Obviously, we've added additional staff, and just like what they did at Northwell, we also basically redeployed everybody at every level across the organization that is not touching patient and who has found themselves having, additional time because of whatever their duties are. So it didn't even matter what your title was, or is. Like right now in my supply chain organization, I have a VP of business development who has been redeployed, and she is just so tickled pink with doing that as a PPE liaison, because we established a PPE liaison program on the floors, especially on the COVID floors, because we have floors that are dedicated just for the COVID patients. And so, at the beginning of this, as we're trying to keep up with their demand, because you can imagine that their demands were just like a lot higher than everywhere else, and there were some hiccups there. So we came together, worked with HR, and said, okay, can we go at the pool of people and then pull out some folks that are going to be dedicated? It's a little bit more than just supply runners, but basically the PPE liaisons for those floors so that they can make sure that they're communicating not only with the floors, but also with the supply chain team. So I have all kinds of people now that are an extension of the supply chain teams that are running and that have been redeployed. And we've done that across the organization as well for people who have found themselves with extra capacity. And, so I don't know that the call outs or what have you, that's not something that's affected us. And I have not heard of anything, and I certainly don't know of anything within my supply chain. I can tell you that.
It's actually good to hear that. With the cultures that you described earlier about how you're maintaining morale in both of your respective organizations, I'm not surprised. And at the same time, I understand where the question comes from, because there are some reports where people are really, really struggling, and it's probably connected to, not keeping the hearts of the teams when they're in crisis. And it goes back to the leadership skills that I think you and probably your colleagues inside your respective organizations are demonstrating. So maybe one of the questions on that topic that might worth asking would be, maybe how have your conversations with your stakeholders, whether it's other leaders or whether it's clinicians on the front lines, but how have those conversations with these stakeholders adapted so that you can keep them informed with this evolving crisis? I mean, what makes the conversations different today than they were before Corona?
I mean, I think there's a sense of urgency that everybody has. So people know that you're coming to them, that this is no BS. Right? Because nobody has time for that. And so, you're engaging people at every level, and there's a more direct approach as well. Whereas perhaps there may have been a little bit of red taping in order to get to XYZ or to this person. And like I said, we've pretty much adopted cell phones as a means of communicating really quickly with each other. And so people that you would normally not find yourself talking to generally on a regular basis have just become available, and we just it didn't matter. It doesn't matter what your title is. It doesn't matter who you are. I need you. I'm sending you a text. Hey, so-and-so, I need this information from you, or here's what I got. Will that work for you? So we've been engaging them differently. And a lot of what I'm calling, again, the pretense has just fallen by the wayside. Egos are out of the door, and, you're on first name basis, no longer Dr. So-and-so. We don't have time for that, right? John, can you get me this? And then the other thing as well is that, it's kind of freeing in this environment where you're actually putting a lot of those folks to work for you, to say, hey, listen, I need information from you. I'm trying to get this. Can you please go out and get me as much information as you can on the particular equipment that you're looking for? I need model numbers and blah, blah, blah. So there's something kind of cool also and fun about being able to tell some of those people, hey, I need you to do that. Can you get back to me in 30 minutes? So the dynamic has shifted, and we're flexing in different roles all the time. So, there's no longer this thing about this is a chairman, this is a chancellor, this is a CEO. It's just about all of us coming together to get it done, and just dropping the pretenses and just going exactly where we need to go, when we need to do it, as quickly as we need to do it.
Yeah, I appreciate that, Regine. And Donna, if you wouldn't mind if I maybe gave a different question just to get, to be more expansive, even with the topics we're covering. There's a tremendous amount of, pace and change and pressure that's actually going on to close these very real operational gaps. And obviously, pausing to celebrate wins is really important to kind of not only keep the morale, but to kind of keep people moving in the right direction. Would you mind sharing whether they're small or big celebrations, like just an example of what you're doing to kind of celebrate those wins as an organization or even within the functions you're responsible for?
It's really hard to celebrate when you're all in different places, because you think of a celebration as a time to, pat somebody on the back, literally, or to step away from what you're doing. And it just, frankly, to be honest, 100% honest, it just isn't the time to do that. So what we do, we send notes a little bit, a few notes back and forth. How you doing? Just thinking of you. Every single email ends up in take care and be safe. And thank you very much for all that you're doing. We never forget that we're the support behind the front line, and always thanking them as well. We send cookies to everybody, and it was a challenge. I'll give you a really real life example. This day and age, you can't send a big platter of cookies or sandwiches that multiple hands are going to touch. People are uncomfortable with that. So we found a cookie company, Milk, that sends individually wrapped kind of large cookies, and we sent them to each of the materials management teams. It's a very, very small thing, but it just a little bit of something like, just thank you for what you're doing. We'll be celebrating. There'll be ways to recognize this when we can all be together in one room again. There's a bit of a challenge to do it when you're all apart. But I would, if you don't mind, if I'd like to add something just to that last question. Cell phones, communication is key. Having, reaching out to the real frontline leaders and touching base with them as often as you can. We all have these leadership structures, but you got to remember that executive director at that hospital, it could be a big hospital, a small hospital, it could be whatever it is. They're on that front line every day, and they're not able to face outward because they're so busy inward. So if we could reach into them, not just to respond when they're asking for something, but to give them information when they need it, is incredibly important. And one other just thing I'd like to convey, I've never been in a situation where the policies change so frequently, because you're getting new information, you're getting new products in. We had to fit test 28,000 people for new masks. How to share that information on a proactive basis as possible, saying that this is coming, what can we do to help you make it happen easily for your staff? That's the kind of stuff that you kind of got to get ahead of in a situation like this. And it helps smooth the communication.
Thank you, Donna. I really appreciate it. I'm going to give the time back to Nancy here, and as I do, I want to just express an enormous amount of gratitude for you two taking time out of your day, for everyone that's been on the phone to invest their time to really learn from each other. And it's my words do not convey fully the gratitude I have for you sharing your examples, and I feel like this conversation could have continued going on. I am truly blown away by your abilities to pause in the moment of a crisis, not just take the time out, but to already be reflecting on the lessons learned and being able to pull up from it. That's just a very atypical thing to do while you're in the storm. So in honor of you, and thank you much for the time. And Nancy, I'll turn the time back over to you.
Thank you very much, Joe. And I'd like to echo Joe's thanks to you, Regine and Donna, for your inspiring comments and for your thoughtfulness in sharing your time and your ideas with your peers today through the SMI membership. It's really wonderful, and we really appreciate all that you've done today and will continue to do for the industry. We will have recording and notes out to our members on Monday. So if you'd like to share this wonderful session with other folks in your organization, you can feel free to do so. And we'll have, as I mentioned, notes to share as well. And we will talk again next week on Thursday at 4 o'clock Eastern Time for another SMI Huddle call featuring Jane Pleasance from Duke, Steve Gunderson from BD, and Jeremy Strong from Rush University Health System in Chicago. Thank you very much for all you are doing, and we look forward to convening again next week. Bye-bye.
Goodbye. Thank you.